A shepherd's struggle. It was a chilly evening in North Texas when Sarah noticed something was wrong with her 5-year-old shepherd, Bella. Until then, Bella had been full of life, running in the yard, chasing after sticks, and greeting Sarah with the usual excited wag when she returned home. But tonight, Bella wasn't her usual self. The first sign came just before dinner when Bella threw up her food and water. At first, Sarah thought it might be a simple upset stomach, something dogs occasionally experience. But as the hours passed, Bella's condition worsened. The vomit turned to bile, yellow and liquid. Then, to Sarah's horror, she noticed small spots of blood mixed in with the bile. Sarah's heart sank. She tried to stay calm, but panic was beginning to set in. Bella's once bright eyes now looked dull with fear. It was evident that something was seriously wrong. Sarah reached for her phone, dialing the nearest vet in a desperate attempt to get some advice. However, the clinic was 2 hours away, and they warned her of a 6-hour wait. That wasn't an option. "Please help me," Sarah whispered to herself, as she stroked Bella's fur, trying to comfort her. Bella whimpered softly, curling up in a corner, too weak to play or even respond with a wag of her tail. Sarah thought back to the day, remembering how Bella had been fine earlier. They had gone on their usual walk in the morning, Bella had eaten her meals as normal, and even enjoyed a treat later in the afternoon. What had gone wrong? Sarah knew that without immediate help, Bella could deteriorate quickly. She couldn't wait hours. With no other choice, Sarah made the difficult decision to drive to the emergency vet clinic, knowing the long wait would only make Bella's suffering worse. She bundled Bella into the car, hoping her faithful companion would be okay for the ride, but feeling a knot in her stomach with every passing minute. As Sarah drove through the dark streets of North Texas, her mind raced with possibilities. Was it something Bella ate? Or could it be something more serious, like bloat or an internal injury? No matter what, she couldn't lose Bella. When they finally arrived at the clinic, Bella was immediately rushed in for evaluation. Sarah paced nervously in the waiting room, hoping for any news. Hours felt like days, and every second stretched on as she held her breath. It wasn't until the early morning that the vet came out with a diagnosis. Bella had suffered from a stomach ulcer, which caused the vomiting and the small blood spots. The vet reassured Sarah that with immediate treatment, Bella would recover. She was given fluids, pain management, and medication to heal the ulcer. As Sarah sat by Bella's side, relieved that her loyal friend would be okay, she couldn't help but think about how important it is to never ignore the signs of illness in a pet. Bella's condition could have been much worse if Sarah hadn't acted quickly. From that moment on, Sarah promised to always trust her instincts when it came to Bella's health, no matter how scared or uncertain she might feel. Advice for others. If your dog is vomiting and especially if there is blood or unusual bile, it's important to seek veterinary help immediately. Vomiting with blood can be a sign of a serious condition, like an ulcer, internal injury, or other medical issues. Delaying care could make things worse, so always trust your instincts and get help as soon as possible, even if it means a long wait.